Will I ever be the same again? Sex after prostate cancer surgery. The truth. Before we dive in, are you aware that up to 80% of men experience some form of erectile dysfunction in the first year after radical prostatectomy? And did you know that consistent pelvic floor exercises can significantly accelerate the recovery of urinary control? Share your thoughts and experiences in the comments below. Don't forget to like, share, and subscribe for more in-depth information on men's health. The shadow of functional outcomes, beyond cancer survival. For many men facing prostate cancer, the initial relief of addressing the malignancy can quickly be overshadowed by concerns about life after treatment. While survival is paramount, the potential impact on fundamental aspects of their identity and intimacy, urinary control and sexual function, looms large. This is particularly true for younger men who may have enjoyed years of active sexual life and now face the prospect of significant changes. The anxiety surrounding urinary incontinence and erectile dysfunction, ED, often dominates discussions, sometimes even eclipsing the focus on cancer prognosis itself. Your guide through the journey, understanding post-prostatectomy sexual recovery. Welcome. My name is Dr. Charles Shabir, and as a urologist specializing in prostate health for over 2 decades, I've had the privilege of guiding countless men through their prostate cancer journeys. In this video, we're going to delve deep into what you can realistically expect regarding the recovery of sexual function after radical prostatectomy, the surgical removal of the prostate gland. We will explore the available options and strategies to help you and your partner navigate this challenging phase and work towards a fulfilling, intimate life. The unsung hero. Understanding the prostate's role in male sexuality. Let's take a step back and appreciate the prostate gland itself. Interestingly, a recent poll highlighted a significant lack of awareness among men regarding the prostate's function. While many associate it with cancer and vaguely know its pelvic location, its crucial role in male reproduction often remains a mystery. The prostate is an integral component of the male reproductive system, nestled deep within the pelvis, between the pelvic floor muscles and the base of the bladder, just in front of the rectum. Its primary function is to produce the majority of the fluid that constitutes semen. This prostatic fluid is rich in enzymes, zinc, and other nutrients that support sperm viability and motility. Attached to the back of the prostate are the seminal vesicles, 2 small sacs that act as reservoirs for this prostatic fluid. During ejaculation, the contents of the seminal vesicles and the prostatic fluid combine with sperm produced in the testicles to form semen. The delicate dance, erection nerves and their crucial role. Perhaps even more critical to sexual function are the delicate networks of nerves that run along the back and sides of the prostate gland. These are the cavernous nerves, responsible for controlling blood flow to the penis, which is essential for achieving and maintaining an erection. Think of them as intricate electrical wires plastered to the surface of the prostate. Intact and functioning cavernous nerves are absolutely vital for a man's ability to achieve an erection sufficient for penetrative intercourse. 2 pillars of sexual function: erection and ejaculation. When we consider male sexual function, it essentially boils down to 2 key elements: erections and ejaculation. Radical prostatectomy can significantly impact both of these. Let's first address erectile dysfunction. Erectile dysfunction, a multifaceted challenge. Erectile dysfunction, ED, is defined as the persistent inability to achieve or maintain an erection firm enough for satisfactory sexual activity. While ED can occur even without surgery, its incidence significantly increases following radical prostatectomy. It's important to understand that ED is not solely a consequence of surgery. Several factors can contribute to it, including age, smoking, diabetes, obesity, high cholesterol, high blood pressure, and certain medications. Generally speaking, the older a man is, the higher his baseline risk of ED. The surgical impact. Navigating the delicate anatomy. During a radical prostatectomy, the entire prostate gland and the seminal vesicles are surgically removed to eradicate the cancerous tissue. The challenge for the surgeon lies in achieving a delicate balance, ensuring complete cancer removal while minimizing damage to the surrounding structures, particularly the cavernous nerves in the pelvic floor muscles located below the prostate. Why surgery can affect function, understanding the mechanisms. Depending on the characteristics of the cancer, its size, aggressiveness, and proximity to the cavernous nerves, the surgeon's ability to spare these nerves can be compromised. If the cancer has invaded or is very close to these nerves, complete removal of the cancer might necessitate sacrificing one or both nerve bundles. Even when nerve-sparing surgery is possible, the nerves can still experience temporary dysfunction due to surgical manipulation, a condition known as neuropraxia. This is akin to a temporary bruising or stretching of the nerves, and recovery can take time, often ranging from 12 to 18 months. The inevitable change, the phenomenon of dry orgasm. Beyond erections, radical prostatectomy invariably leads to changes in ejaculation. A significant component of the sensation and enjoyment associated with orgasm is the emission of seminal fluid, the majority of which originates from the prostate gland. Once the prostate is removed, the ability to ejaculate fluid is lost permanently. This results in what is known as a dry orgasm. The subjective experience. What does a dry orgasm feel like? The experience of a dry orgasm varies significantly among men. Some report that the sensation feels largely the same, just without the expulsion of fluid. Others describe it as less intense or shorter in duration. Interestingly, a small subset of men even report a more intense sensation. The key takeaway is that this change is highly individual, and predicting how a specific man will experience it is impossible. It is crucial to be aware of this inevitable change when considering treatment options. The silent shrinkage. Understanding penile length loss. Another potential consequence of radical prostatectomy is a loss of penile length. Prior to surgery, men typically experience several spontaneous erections during sleep each night, nocturnal erections, particularly if they had no pre-existing erectile issues. These erections contribute to the health and elasticity of the penile tissue by ensuring regular blood flow. The mechanism of shortening. The sponge analogy. Following surgery, these nocturnal erections often cease, especially in the initial recovery period. If blood flow to the penis is not adequately restored and maintained through rehabilitation efforts, the penile tissue, which can be likened to a sponge, can lose its elasticity and shrink. Consequently, some men report a noticeable shortening of their penis after surgery. It's important to understand that this is not due to the surgeon removing a portion of the penis, but rather a consequence of reduced blood flow and tissue changes. The unexpected leak, climacturia and urinary incontinence. As you mentioned, urinary incontinence is another functional issue that many men experience after prostatectomy. While most men regain urinary control with dedicated pelvic floor physiotherapy over time, there can be an overlap between the return of sexual activity and the complete resolution of incontinence. In some cases, men who become sexually active relatively early in their recovery may experience the involuntary leakage of urine during orgasm. This phenomenon is known as climacturia. It occurs because the muscular control of the bladder may still be recovering, leading to relaxation during the intense physical sensations of orgasm and the subsequent release of any urine present in the bladder. Charting the course to recovery, available options and strategies. So what can be done to address these post-surgical challenges? Fortunately, we have several key mechanisms for aiding the recovery of erectile function and dedicated strategies for managing urinary issues. The foundation of recovery, factors influencing erectile function. The likelihood of recovering erectile function after radical prostatectomy is influenced by a multitude of factors. These include preoperative erectile function. Men with good erectile function before surgery generally have a higher chance of recovery. Pre-existing risk factors, conditions like obesity, smoking, diabetes, high cholesterol and high blood pressure can negatively impact nerve function and blood flow, potentially hindering recovery. Age. Younger men, typically under 65, tend to have better nerve function and a higher probability of recovery. Cancer characteristics. The size, location, and aggressiveness of the cancer dictate the feasibility of nerve-sparing surgery. If the cancer necessitates the sacrifice of the cavernous nerves, the chances of spontaneous erectile function recovery are significantly reduced. Surgical technique: bilateral nerve-sparing surgery, where both nerve bundles are preserved, offers the best chance for erectile function recovery. The waiting game: nerve regeneration and the role of medication. Even with successful nerve-sparing surgery, the cavernous nerves often experience neuropraxia and require time to heal and regain function. This process can take anywhere from 12 to 18 months. During this recovery period, various medical interventions can play a crucial role in facilitating the return of erectile function. Phosphodiesterase, type 5 inhibitors, medications like sildenafil Viagra and tadalafil Cialis are commonly prescribed prophylactically after surgery. Contrary to some misconceptions, these drugs don't typically cause an immediate erection in the absence of sexual stimulation, especially in the early postoperative phase. Instead, their primary role is to increase blood flow to the penis, which helps maintain the health of the penile tissue and may improve the chances of spontaneous recovery over time. They create a more favorable environment for the nerves to regenerate and for blood vessels to function optimally. In essence, they are promoting penile rehabilitation. Direct action: the role of penile injections. Penile injections: this option involves injecting a medication, typically prostaglandin E1, Alprostadil, directly into the base of the penis. While the prospect of self-injection can be daunting for many men, it offers a higher probability of achieving a meaningful erection suitable for intercourse in the short term. Furthermore, similar to PDE5 inhibitors, these injections help maintain blood flow and oxygenation to the penile tissues, potentially aiding long-term recovery. Overcoming the psychological barrier associated with penile injections can be a significant hurdle, but the potential benefits in terms of both immediate function and long-term recovery are considerable. Mechanical assistance: the vacuum erection device. Vacuum erection devices, VDs. These devices consist of a plastic cylinder that is placed over the penis and a pump that creates a vacuum, drawing blood into the penis to create an erection. While VDs can enable sexual activity, it's important to note that they draw deoxygenated blood into the penis. Unlike the increased oxygenated blood flow stimulated by PDE5 inhibitors and injections. Therefore, while useful for achieving rigidity, they may not offer the same tissue health benefits as other options. 001206. The surgical solution: penile implants. Penile implants. For men who do not recover adequate erectile function through conservative measures or who had poor erectile function before surgery, a penile implant is a surgical option. This involves the insertion of an inflatable or malleable device into the penis, allowing the man to achieve an erection on demand. While a comprehensive discussion of penile implants is beyond the scope of this video, it represents a reliable solution for regaining the ability to have penetrative intercourse. The unsung hero of recovery: pelvic floor physiotherapy. Crucially, the role of pelvic floor physiotherapy cannot be overstated. I strongly encourage all my patients to consult with a specialized pelvic floor physiotherapist, both before and after surgery. Pre-operative physiotherapy helps men understand the anatomy and function of their pelvic floor muscles and learn how to contract them effectively. Post-operatively, dedicated physiotherapy is essential for regaining urinary control more quickly and effectively. Furthermore, there is emerging evidence suggesting that strengthening the pelvic floor muscles may also indirectly contribute to improved erectile function recovery by enhancing blood flow and nerve function in the pelvic region. When men actively engage with a skilled physiotherapist who has specific training in post-prostatectomy rehabilitation, the outcomes are consistently better. They develop a deeper understanding of the exercises and are more likely to adhere to a consistent program. Embracing adaptation in patients: the path forward. In conclusion, as you can see, a multitude of factors can influence a man's sexual function following radical prostatectomy. Recovery takes time, and a key element is adopting an adaptive and patient mindset. Open communication with your partner about these practicalities is essential. Be open to exploring different avenues of rehabilitation and intimacy. The goal is to work together to achieve a fulfilling sexual life that satisfies both you and your partner moving forward. Your experiences matter. Let's connect. I sincerely hope this video has provided you with valuable insights. If you have any comments, would like to share your personal journey, or have questions, please feel free to leave them in the comments section below. Sharing your experiences can make a significant difference for other men navigating this journey, letting them know they are not alone and that others have walked this path. Until next time, take care.